From FlourishDX, this is the Psych, Health and Safety Canada podcast, with workplace mental health becoming a priority for businesses who want to retain staff and prevent burnout. This is the source of information for creating sustainable and psychologically healthy workplaces in Canada.
Welcome everyone to Psych, Health and Safety in Canada podcast. And just to say, this is my last podcast, and I'm welcoming and handing over the reins to Kim MacDonald. So here to take us through this transition is the great Jason Van Schie, and he's going to help us make this transition. I want to say that it has been an honor and a privilege for me to have done this for the year. I got to meet some great people that I didn't know before, to learn from them, to be inspired by them. And I got to talk to some of my friends, some of the people that I've worked with in the last decade around psychological health and safety. And being able to do this has really motivated me to think differently, to look at new opportunities. And so handing it over at this point to Kim, I know there's lots of people who are interested in being guests on this podcast, and I will keep handing them over to her. And hopefully we just keep spreading the news. FlourishDX, which is Jason's organization, has sponsored this podcast and continues to get the word out all around the world. So with that, Jason, welcome and thank you for the opportunity.
And Marianne, when I reached out to you would have been over a year ago now, like you said, and asked you if you would be willing to host a Canadian version of the Psych, Health and Safety podcast, and you said yes, that was amazing. There's a reason you're called the godmother of Psych, Health and Safety, and could think of no one better to lead the charge in Canada. And 57 episodes that you've done. It's been a long time between drinks for us. I was on episode 1 to introduce you as the host and get to know you a bit, but happy to be back. And I'm glad that we found a host to take over the reins from you, so that the podcast can continue and we continue to spread the message around systemic risk-based interventions for workplace mental health.
Yeah, it's been a pleasure. We're looking at doing a new version of the book, The Evolution of Psychological Health and Safety. The Evolution of Workplace Mental Health in Canada. And part of that is, organizations like yours and things that have sprung up around the world, that it's not just a small group of people anymore. And I really welcome that. Of course, there's going to be growing pains as different people try to understand what psych health and safety actually is. And because FlourishDX allowed us to take those snippets from all of the guests, we're able to share it in a way that the average person can learn what psychological health and safety really is, rather than just the textbook or the regulation definition. So that's exciting. What does it feel like? What is it like to actually be in a place that is psychologically healthy and safe?
And I got to say, that was good foresight by you, Marianne, asking that question from episode 1 and continuing to do that with all of your guests and making sure that we collected those snippets. And so for those listeners who aren't following Marianne on LinkedIn, I believe that's how you're sharing it, isn't it, Marianne, through your own LinkedIn, the snippets of what is psychological health and safety?
Yeah, it's interesting because it's how people feel, which seems like it's a very difficult thing to impact. And yet that's exactly what it is. How we interact with each other, how we treat each other, how safe we feel. And the beauty of it all is that it also supports productivity, performance, commitment, loyalty, all the things that employers want. And it doesn't take them becoming mental health experts, which is, I think, the fear that employers had in the beginning of this. that you want me to diagnose, you want me to know if somebody's struggling. No, we just want you to treat everybody in this way, and you don't have to know.
Yeah. Well, Marianne, you've done an amazing job over the past year and 57 episodes of the Psych Health and Safety podcast. We look forward to having you on as a future guest with our new host. But we should probably introduce her in and let the listeners get to know her. So, Kim, you're actually a guest of Marianne's early on. So maybe you should come on for the listeners who didn't hear your episode. Maybe you can introduce yourself.
Sure. Thanks, Jason. Thanks, Marianne. These are indeed big shoes to fill. So I'm very excited about the year ahead and how we continue to do the work that you've started and Jason and his team are supporting. So it's pretty exciting, and it's an exciting time, I think, in 2023. Hard to believe we've come through the last 5 years the way we have. We probably, all of us, wouldn't have looked back and thought that some of the challenges and the changes in work that had occurred would have occurred. And so that's all the learning and the skill building that we have already in our, at our disposal going forward to make even more changes. So a little bit about me. So I live in Nova Scotia, Canada, which if you are longitudinally and latitudinally adept, we're straight across from Bordeaux, France. I like to say that because who wouldn't want to be in Bordeaux, France, but please also come to Nova Scotia. That's my tourism Nova Scotia hat right there. But I'll trade someone in Bordeaux, France, my house for theirs if they're willing. So that's a little aside, Jason. We'll just move past that. So a little bit more about me. I have 2 fantastically interesting children by birth and 1 by choice, they're part of the impetus for me actually getting into psychological health and safety, and which was around, the research started about 10 or 12 years ago. And my company, 13 Factors, started 5 years ago. And at that time, they were just entering the workforce. And as in many things in life, it was a convergence of things. My early career was in public relations marketing and communications. And if for anyone who knows that in business, understands that it's all about influence and understanding the behavior of people. And so that was really in that work where my passion was. And that was looking externally at external markets and growth plans. But some of the factors that were indicators on success in those businesses implementing their strategies really were inside. So that sort of had me pivot a little bit and look inside organizations, which I jumped into a deep study of culture and leadership, motivation, engagement, and all the factors and influences. And then as the perfect storm, a time in my life when I was in the midst of a mental health struggle, it really became clear to me how some of these factors are really important to dig deeper and understand. And I had the fortune of having a great psychologist. Didn't have you, Jason, but I'm sure but my psychologist was amazing to help me have insight into some of those influences. And so all of that influencing really came together. And my discovery of the Canadian standard also happened around 2014. And it was sort of all the light bulbs went on and all the linkages started to link together of all the research I've been doing, the academic research. I consider myself a pracademic. So I like to apply all the beautiful research that academics do into the workplace. And so in 2018, I launched 13 Factors and have been working in psychological health and safety ever since.
You know, Kim, I think about the fact that people say, well, is psychological health and safety for people who are struggling with their mental health? And I said, it's no different than whether removing hazardous chemicals are really only for people with respiratory problems. It's not. It's for everybody. But those that are more vulnerable, it has even more of an impact. And so I think one of the beauties of it is that the employer, the leader, the manager, if they use this approach, it works all of the time rather than just for a select group of people.
I think for employers, I think, right now there's some of the things that we're seeing where there's a huge investment, I think, in mental health conversations and awareness building, certainly in Canada. The challenge is going to a different focus now. And that is around looking at work conditions, management approaches, management systems, and work design. And that is a more complex challenge for leaders to get their heads around. But this is the solution. And I think one of the reassuring things, I think, for leaders is that humans are open systems. If you understand anything about open and closed systems, then we're an open system. So there are influences and factors, and there are indicators to track and understand and interpret. But they already are doing all that for many other areas of risk in their business. So this is really taking a look at sort of this broader look at occupational health and safety. And so using all those skills they already had and doing some convergence and blending of those skills so that they can use it in this different way to ensure that they are doing it consistently and they are doing it systematically across the organization for the benefit of all. So that's kind of, I always think that is a message of reassurance that we are open systems and it's a shared responsibility for psychological health and safety in the workplace.
In the Canadian standard, they say, sorry, go ahead, Jason.
I was just going to say, I was actually going to refer to the Canadian standard as well. And, you know, it's now, 10 years old. And I believe that the technical committee will be meeting again this year, right, Marianne, to review and update as required?
We are.
Yeah. And
as we speak, we are.
Yeah. And I know Kim is very jealous of the regulatory reform we're getting in Australia where psychological health and safety is being elevated to the same level as physical health and safety. But you talked about how this is the approach that companies should be taking. And Marianne kind of alluded to some of the benefits. But 10 years in, why isn't it common practice? What are the things that companies are doing instead in Canada?
I think the focus has been on the employees themselves and some of the support opportunity for employees around their mental health and understanding mental health generally. So I think raising that conversation is something that's been across in the public domain and has definitely entered into workplaces. The pandemic has helped raise the conversation level. A lot of work of organizations across the country, like the Mental Health Commission of Canada and the Canadian Mental Health Association, and have been working on stigma reduction and helping people understand about mental illness and anxiety and depression being some of those statistics in Canada that are the highest that we have in terms of mental illnesses. And we have a lot of data now that we didn't have 5-10 years ago in terms of we've got public studies that are much more prevalent and published. We have data gathering by Stats Canada that is now monthly and reporting annually on workplace claims, on disability. So we have a lot more information today than we had 5 years ago. And so that's another opportunity that workplaces can take advantage of to better understand and make evidence-based decisions. But the focus on people and the resilience, I have a little bit of a challenge. I might have my own bias around when it gets so far that we continue to only focus on the resiliency of employees and don't take a look internally at the workplace conditions. We're only looking at half the equation. And as I say, we have better data now in Canada and more researchers doing work on workplace design and workplace conditions than we've ever had. And we have the global ISO standard. So we have those resources where before we were coming out of, I think, from a mental health perspective, from a health promotion perspective. And that model really focused on a lot of the awareness building we had. But now it's the time is right to shift and look differently with the new data we have.
I'd just like to add to that, Kim, that really the issue is for psychological health and safety, it's the way we treat each other. And if we don't change behaviors, if we just change systems and documents and policies and programs, that is never going to have the impact that we want. And it has to be that if you are a people leader, that you ought to be able to manage, support, and lead people in a psychologically safe way. And I think that is the piece that has the biggest impact And yes, that's a lot of responsibility for leaders, but we need to stop putting people into those positions that are unable or unwilling to understand the impact that they have on others. And instead, take those who are willing and support them rather than point out what they're doing wrong, but support them to be able to evolve into a leader who can provide a psychologically safe work environment. And then the last thing I'll add to that is, even if the leader is, the most wonderful leader in the world, if they're not able to change the way the employees treat each other, then they'll never be successful. So we really need to start to focus on the interactions between people. The system stuff still has to be done. That's how we're going to scaffold it. That's how we're going to make sure that it's consistent and ongoing. But we always have to look at what impact does this have on behaviors and words and actions, because otherwise it's not going to change.
Absolutely. I think the behavior component is probably why the struggle to make this pivot and shift to the work conditions and the environment that's being created by some of those behaviors and some of those decisions people are making on a day-to-day basis. And we have a lot of workplace rules and guidelines and cultural norms that have been in place for a long, long time on how we actually operate and what a well-functioning workplace looks like. And we've known also for a long, long time that those conditions need to be up for debate and conversation, and that they are, there's a lot more that we know about what people need and humans need at work, and the neuroscience of change and all kinds of things that we've never applied to the workplace in a long, long time. So change, I always say that society, as tough it is for us to make changes at a society level. So society changes first, then the workplace, and then the law. And all of those things together, sometimes one is pushing the other, but we've had a lot of change in the last 5 years, and a lot, I think you can't get away from the data, even if you're not doing the data within your own organization. Because there's a lot of commonality around those cultural norms, particularly in Canada and other regions where we've embraced certain ways of managing that we now know more and we know better. And so making those changes, progressive leaders are starting to do that and starting to understand that. But operationalizing that and scaling that inside the organization can be daunting for leaders. So trying to figure out what works for them right now so they don't have to do everything at once. It's really to figure out better understanding of what a hazard is, I think, is a really good starting point too. Because I think that cause and effect or a correlation is not really understood in business as much as maybe in other, in healthcare institutions, for example.
Yeah, and we're observing that globally, Kim. It's not in Canada, just in Canada, but I think during the pandemic, businesses and leaders were trying to do what they could to support the mental health of their workers, understanding the impact that all this rapid change was going to have on them, and they kind of just threw benefits at people, tried to make mental health support available. And I think now there's this period of consolidation that's going on where people are going, well, actually, those things didn't really drive the positive impact that we thought they would. We did the best with the information that we had and just threw resources at it, but it clearly didn't work. And so now people are starting to take a step back and go, well, actually, what does the evidence suggest?
Hi, listeners. Jason here. We hope you're enjoying this latest podcast episode. Now, if you're like Joelle, Alicia, and myself and enjoy learning from the best, then the FlourishDX Academy is for you. The Academy includes free e-learning courses on the ISO 45003 standard for psychological health and safety at work, and associated topics such as how to conduct a psychosocial risk assessment and how to create the business case for psych health and safety. All courses feature high-quality videos, downloadable resources, multi-choice questions, and a downloadable training certificate on completion. Take your learning to the next level with all FlourishDX Academy courses included within the FlourishDX mobile app. Select podcast episodes from the Psych Health and Safety podcast and sister podcasts from Canada and the USA are also included. Get started with FlourishDX for free at www.flourishdx.com/get-started. That's www.flourishdx.com/get-started. Now back to this episode.
So, Kim, can you share with us what you tell employers is the return on investment or the ROI in really addressing and improving psychological health and safety?
Well, I think that the return on investment and the understanding by senior leadership is one of the kind of pivotal needs for the change, and understanding what is the return on investment, what is the impact, but also understanding how it relates to their business. And every business, there's context, but using the standard and whether you're using the ISO standard as a guide or the national standard in Canada or another from another jurisdiction, it is always contextual. So they have to, if they don't have a really good understanding of their own indicators and their own numbers, that's really an important place to start. But most businesses do. And so using that data to demonstrate what are some of the things that are happening inside the organization, what's happening with retention, what is happening with their positioning as a best place to work, in terms of their culture and what people are saying. So understanding those kinds of things, what's the financial and the productivity numbers that they have, what's the level of engagement, how are people connected and motivated within the organization, and are there challenges in behaviors? Are there workplace investigations? Are there complaints from their union? All of those kinds of pieces of information are all incredibly important to the conversation around psychological health and safety at work, and helping leaders understand that they typically have a lot of data already that they can start to use strategically and have conversations around it. And that will show them what some of the return is. And then we can bring in some of the data from evidence-based studies, and also if they want to start benchmarking a particular set of factors that they want to start measuring, then doing interventions, and then figuring out how progress is being made, they can do that as well. But typically, I think it's helping them jump that gap between the data that they already have and what it's telling them about psychological health and safety in their workplace. And as I said, if they have been under, they've had workplace investigations, or they've had concerns or interpersonal relationship issues, if there's harassment, bullying, on some of the extreme ends of the spectrum for psychological health and safety, then that is important information for them to start to look at. And they're probably looking at that already because it already holds a financial risk. So where are some of those financial risks? And then we can start to look at how do they want to work with that and make a change, and what are the appropriate interventions based on their context.
Lots of different measurements and evaluation points where I say, what if your employees wanted to come to work, were supported to do their best work every day, and left at the end of the day with some energy left over? So all of that. What do you see, Kim, as the trends in where we were 10 years ago, where we are now, and where we're going in terms of employer uptake?
I think it's we have a mixed situation. And I say it's mixed because we have lots of bright spots on progress and development. And I know we're going to talk about legislation in a little bit, which is good, which is incredibly important to this conversation. But we have leaders who already know, based on some of the data that they have, that they're having struggles with retention or attraction, that they're starting to see that employees want different things and a different relationship with their work. And I think we can all support and appreciate Generation Z and millennials, well, all of the generations, because we've all had a hand in making all these changes happen. I used to say hug a millennial with permission, because they've really led the charge in helping us see that we can actually have a different relationship with work, because they have different lifestyle, sort of understanding of the lifestyle they're looking for. And therefore, that opened the conversation much more broadly to all kinds of other related things around the workplace culture. And then that leaps into how the psychological health and safety conversations. So I think some of those trends are really some of the employees and what they're looking for from organizations, and organizations then being required to have that conversation with themselves and figure out, are they building something that people want to work with? Like, and if they're not, then where are the gaps and what do they need to do to build an organization that will attract and keep people? And that is sometimes in the depth of policy change. And we see that around inclusion and diversity work. And also it's some of it just the daily experience that people have at work. So that's one of those things. And it's sort of that the new worker workplace relationship. The second thing is we have a lot more data than we've ever had in Stats Canada. And Canada is now capturing, as I mentioned before, disability data and talking about what are the highest rates of claims. 30% of them are for mental illness and mental health related illness, and 70% of the costs are related to mental health at work illnesses. So those are big numbers and big cost factors for organizations. So numbers do speak to organizations as well as legislation. And we have more conversations in the public domain about mental health and people's mental health, and comfort in sharing that mental health is part of my overall health. And that is an important conversation to continue, but we still have stigma and we still have behavior, people not taking organizations up on some of their extended healthcare benefits because they worry about confidentiality and other things like that. So we've seen some positive changes, but there's a lot of work to be done in workplaces to show that it doesn't matter what your size or what your industry, you can make positive changes.
Mm-hmm. It just reminded me of why I got into psychological health and safety to begin with, is because my work was originally helping individuals with a diagnosed mental illness to be able to go back to work and be productive and be supported. And I kept noticing that in some cases, it was very easy to do that. And in other cases, it felt like an uphill battle. And when I stepped back to look at what's the difference, I didn't have the language then, but it was in a psychologically healthy and safe workplace. Sure, what can we do? How can we support you to do your job in spite of this? And in the other workplaces, it was like everybody's stressed out, everybody's angry, everybody's pressured, everybody's burning out. So how can you bring somebody back into that kind of a workplace? And many of the things that you just discussed are the things that are being discussed around the table for the Technical Committee for the Canadian Standard. Is, diversity, inclusion, stress, trauma. How can we make this so that it's even better than it was and easier to use? So that's the challenge with it all. But we've talked and with Jason about what's going on in Australia with the changes to legislation. And there's some people in Canada who are really advocating for that. Dr. Martin Shane is one of them. What are your thoughts about what's happening in the legal landscape in Canada and indeed around the world?
Well, here we have some positive changes. We've had some changes over the last 5 years to the Canada Labor Code. So if you are a federally regulated industry, like transportation, banks, band councils, and other related, the public service, the federal public service, your legislation and your regulations come from that legislation, and you must follow that. If you are a business in another industry, then your legislation and occupational health and safety and psychological health and safety and harassment and bullying comes from other legislation. And that's at a provincial and territorial level. So we have an inconsistent approach to all of these kinds of issues in the workplace in Canada. And so that consistency and having some language that is much more clear. For example, if you had an issue and workplace stress, and you were going off on stress, if you fall within human rights legislation and protected characteristics, there is protections there for harassment and bullying. If they've made some changes to the Canada Labour Code around workplace violence, and so if you're a federally regulated industry, then you, as an employer, you're required to follow that legislation. But there are differences across Canada. In Ontario, Ontario's done some really good things around, I think it's Bill, what is the bill that is I had it written down just so I'd remember, made some changes to after hours sort of action by employers, contacting employers in hours where they are officially not at work, and putting restrictions and restricting behavior around that in legislation. And so therefore employers in Ontario have to take a look at that and start implementing that and seeing how their behavior and scheduling and their managers are working with that new context. And also we've had changes to the way that workplace investigations are investigated in Canada for harassment and bullying and other difficult behaviors in the workplace. And those are right now under the Canada Labour Code. So that I think is Bill C-65. So there have been changes with the way that workplace investigations. So we've seen changes across the country, some very positive things, but we are lagging in some areas as well, and certainly around consistency.
I've said to people before, if you're not happy with the baby steps that we take forward, then you're going to be frustrated in this work. And we have to just keep putting it forward, making a little bit of progress and continuing on. So I'm going to pass this over to Jason. And I think he's got a question or two for you, Kim.
Yeah, Kim, obviously very large shoes to fill. As we talked about with Marianne, we'll have to give you a moniker. I think the godmother of psych health and safety is taken, so we'll have to come up with something else. But hey,
that's taken. I think it should remain where it is. Yes.
But look, Marianne put her own stamp on the podcast, as has David Daniels with the USA podcast. So, what do you hope to achieve as hosts of the Psych Health and Safety Canada podcast moving forward?
This is like, it sounds like a little bit like the PR answer, the PR guru's answer. It's going to evolve over time. I think my goals are going to evolve as I talk to more and more people, and as things evolve in workplaces across Canada, and some of the changes that Marianne had mentioned that are coming definitely for the standard. One of my goals will be to help shift that understanding with workplace leaders about the return on investment. And that is, it's part information, part trying things out, helping organizations see that they can make practical changes that they can implement and start testing some of the positive outcomes that they will see and then build on the positives. I think once organizations start to see that change is possible and where that change really fits with what their values are for their culture, then the change gets easier and easier. But for some organizations, they have to test and pilot things and experiment with it in a really practical way before beliefs change. And that's the same for humans. So for some people, we think that beliefs come first, but for some people, trying things out actually shifts their understanding and their belief about what is actually possible for them and what is the best way forward. So I think that return on investment for senior leaders. The second piece so some of these things are really kind of content specific, but also about shifting people's understanding about psychological health and safety. And one is around hazards and risks. And some of those correlations between some of those behaviors that Marianne had referenced and other policies and what those are really sort of potentially doing inside your organization as risks and hazards. And we have so much really good conversation in different pockets around inclusion and diversity and decolonization. And I think that is a really good conversation for psychological health and safety conversations if we're looking at something that is making a system and management change.
So I've got to say, like yourself, or from our own experience, being able to talk to the who's who of psych health and safety internationally And as Marianne said, there's actually quite a number of people in the space. It's not this small group of half a dozen or a dozen experts. Joelle and I have spoken to, well over 100 people now who are primarily working in this space of psychological health and safety. So definitely the biggest benefit, like being selfish for myself, has being able to connect with those people and learn from them, rather than having to read their books. They can actually, share with me from the horse's mouth, some of their greatest insights from all their research or all their work. But like yourself, I see, yes, I think senior business leaders do need to understand the return on investment, but we need case studies as well that put forward the moral argument, showing the benefits to employee wellbeing, as well as retention and productivity measures as well. So we're working on some case studies ourselves, and I know that there's a number of companies that have been followed from adopting the Canadian national standard as well, and the benefits that they obtain. So the more we get, more case studies that we can get to the point where it's undeniable that this is the way to do it, and you're going to drive all these positive benefits for business leaders, the better.
Yeah, I think sharing those stories and having, I think the breadth of stories in Canada, some of the smaller organizations that are testing and trying some of these things out, sort of shining some light on those stories as well, so that so that this system of thinking and system within an organization is accessible to more organizations. And until we get some legislation, and obviously in occupational health and safety, legislation and regulations and compliance and reporting are essential. And the moral, progressive, sort of that innovation that can happen and attached to the values that the organizational leaders and the employees themselves want to live out in workplaces are part of the solution too.
So Kim, now you're taking over the podcast. You're going to carry the torch, take over the reins, and I'm really glad to see that FlourishDX and the team there is going to continue to support this. I can tell you they've been fantastic for me in terms of being supportive and helpful. And you now are going to make a difference, help people change their mind, help people be motivated and inspired. So thank you for taking over. And I'll pass it over to you to close this podcast off as you start your new year of podcasts.
Thanks, Marianne. Yes, it's an exciting time. And thank you, Jason, for the opportunity. And you can watch all of the podcasts for all of the areas around the world. Check out FlourishDX to do that on the YouTube channel, as well as wherever you get your podcasts. And you can also always reach out to Jason, Joelle, and myself on LinkedIn. Happy to have a conversation around psychological health and safety, and always looking for the case studies that are emerging all over the world that we can use to help build and support the message that this process and this approach is going to help both your return on investment in organizations and make the daily experience for workplaces and improve mental health at work. So thanks for tuning in, and reach out to us on, as I mentioned, on LinkedIn, and check out the other episodes for the Canadian podcast as well. And we'll see you soon. Take care.
You've been listening to the Psych Health and Safety Canada podcast. To stay up to date with the best content on workplace mental health in North America, subscribe wherever you listen to podcasts and join the FlourishDX community at www.flourishdx.com.